May I come in, madam? Good morning, madam.
Namaste. Myself, Dr. Santosh Naik, HOD and Professor, Department of Agatantra, Major SD Singh, PG, Ayurvedic Medical College and Hospital, Farooqabad. So, as you know, today we are observing as World Cancer Day. So, in this regard, we are going to discuss this about the cancer disease along with Dr. Ruma Dey, Associate Professor, Department of Kai Chikitsa. Madam, so can you give some major points regarding cancer disease that everyone needs to know?
नमस्ते, मेरा नाम डॉक्टर रूमा दे है. Currently, I am working as an associate professor at Department of Ayurvedic for Major Residing PG Ayurvedic College and Hospital. Like rest of the world, Major Residing family is also observing World Cancer Day. And through this observance, we would like to highlight what is the importance of observing this particular event and what through this observance, what kind of message we can send to the general people as well as to the teaching faculty as well as to the student.
Okay, madam. Now, can you exactly explain about what the cancer disease is?
Sure, sir. See, cancer is not a single disease, but a group of disease where the cell grows invariably and results into metastasis by spreading to nearby tissues as well as other organs. Based upon the involvement of the organs, be it kidney, be it your liver, be it your lung. So, as per the involvement of the system, it shows symptoms.
Okay, madam. You have told about what is cancer. So now we have to understand what is cancer. We have understood, but now please explain us about the causative factors of the cancer.
See, cancer is caused because of gene mutation, which results into uncontrollable proliferation of cell. And again, it is very much important, one should know that the reason of cancer is multifactorial. It could be genetic, it could be your lifestyle factor, or it could be an environmental factor. Again, interestingly, 50% of the cause of cancer is your lifestyle factors. And in that case, faulty dietary habits, be it consumption of ultra processed food, smoking, alcohol consumption, or in case of lifestyle is sedentary lifestyle, no one is interested in doing exercise or yoga, or pollution also plays a very instrumental role in causing cancer. Why these causative factors are detrimental for the body? In the long run, it can result into your hormonal imbalance, chronic inflammation, or any immuno alteration.
Okay, madam. You have explained nicely about the causative factors of the cancer. Now, can you tell me the preventive aspect of that cancer disease?
Yes, sir, sure, why not? See, there is a branch called Preventive Oncology, which specifically deals with preventive approach in cancer. How by changing one's lifestyle, by including certain factors which can help in prevention of the disease. Immunomodulation is the most crucial factor in preventive oncology. It detects the pre-malignant cell earlier and removes it from the system.
Okay, madam. As we are Ayurvedic physicians, can you explain the role of Ayurveda in the cancer management?
Definitely, Ayurveda plays a very important role in terms of preventive approach of cancer. As I've already discussed about immunomodulation, in Ayurveda, this immunomodulation stands in three basic pillars. First one is Ahar, second one is Chesta, and third one is Rasayan. When it comes to Chesta, we also speak about physical activities, yogasanas, and when it comes about Rasayana, there are various single herbs and yogas. Herbs like Amlaki, Guduchi, Haldi, and yogas like Chavanprash, Triphala, all these drugs, if taken judiciously, those plays a very important or crucial role in preventive approach. Interestingly, all these drugs have been proven or substantiated by various peer-reviewed journals internationally as well as nationally.
Thank you, madam. I think all of you have understood the causative factor and the preventive aspects of the cancer, which you have explained briefly. But be cautious when you are going to approach any preventive measures according to Ayurveda. Please consult a Ayurvedic physician before taking the medication.
Yes, definitely.
Yes, madam.
With this podcast, we have tried to educate people about the cancer and its preventive approach and hoping for a cancer-free
Cancer-free
world.
world. Namaste.
Namaste.